Our next speaker will be Dr. Kiran Turaga. Dr. Turaga is a renowned surgical oncologist with specific expertise in metastatic cancer. He completed his surgical residency at Creighton University and his fellowship at the Moffitt Cancer Center. Dr. Turaga holds a master's degree also in public health from the Johns Hopkins School of Public Health. Dr. Turaga is interested in patient-centered management of patients who have complex malignancies. Prior to joining the University of Chicago, he was the Sharon Wadena Endowed Professor at the Medical College of Wisconsin. Along with the regional therapy teams, he has successfully created one of the premier programs for cytoreductive surgery and regional therapy in the nation, a program which currently attracts patients from across the country. Dr. Turaga's research is focused on patient outcomes with metastatic cancer. He's published over 110 journal articles and has contributed scholarly work to leading oncology textbooks. Additionally, he's currently a section editor for the Annals of Surgical Oncology. Dr. Turaga is the Fellowship Director for the Complex General Surgery Oncology Fellowship here at the university and at the North Shore program. A wonderful physician teacher, he was awarded the Department of Surgery Excellence in Teaching Award in 2016 and 17. Dr. Turaga will now present a paper entitled Patient-Centered Care for Patients with Advanced Malignancies. Kiran Turaga.
Well, thanks, Dr. Siegler, for inviting me. Thanks to the Bucksbaum Institute for letting us share some of our work. I think it's very hard, Dr. Dhaliwal, before you step out, I just wanted to say, fantastic work. I'm sorry I maybe stopped you on your way to the toilet, but I did my medical education in Delhi, and I think it's remarkable for me to see what you have accomplished. And so thank you very much for doing what you're doing, and I think it's an honor to be speaking after you. Thanks. Today I just wanted to speak a little bit about something that we did last year in collaboration with the Bucksbaum Institute, and perhaps I'd love to invite all of you to help us think about the same event as we plan it next year. When I was a surgical resident in my second year of residency, I perform, as you heard, I do surgeries for metastatic cancer. I remove all the cancer and then place heated chemotherapy inside the abdomen. We believe the heat actually potentiates the effect of the chemotherapy. It's done for 90 minutes during the operation. And colloquially, we used to call this operation the shake and bake. I went to a conference once as a second-year resident where I presented some work on this, and I was interested in this field early on. And we had a patient actually who stood up on the stage, and I've never seen a patient actually speak at one of our medical conferences, but she did. And she's now no longer with us, but she had the courage to tell a room full of maybe 120 surgical oncologists, all who considered themselves God or had some form of God complex, that shake and bake was just purely demeaning to her as an individual. And she said, call it a chemoperfusion, call it a HIPEC, call it what it is, but don't forget that I'm a human being under your knife on the table. And so I think, over the years, of course, I finished my residency fellowship, just too long, kept going on and on and on. And then I was faculty for many years, and I felt that I had reached a stage where I was providing very patient-driven care. I was very proud of what I did, and I think in hindsight, I do think I was also getting that sort of, God complex. I hate using that word, but, we were. As surgeons, you get this sort of enormous sense of gratification from what you do, and I think I did. And so I invited one of my patients, and I'll tell you a little bit about him, to speak at one of these conferences to our residents and students, thinking that I could potentially recreate all of this. And the first thing he said was, he kind of told us how doctors should sort of behave. But one of the first things he told me was, you should call me more often and on time when you tell me you're going to call me. And I just realized that, I had fallen into the same trap where, I was busy, I was operating a lot, I had many excuses to make, but I just realized that I had stopped treating him as the human being that he deserved to be treated as. And so I think that's really what drove us to think about, having this event, which we did in August. This was a small event that we had on August 2nd here. It was at the Knapp Center. We planned for a small panel discussion. We titled it as Patients as Teachers. This was the one opportunity I thought, and I think all of us, when we had our prep meetings, Matt and Dr. Siegler, Angela, and the gang, we thought that this would kind of be a nice way for patients to have a voice where they were not under any form of imbalance of power. They were able to speak what they thought. They were able to give us their feedback. And this was a 1-hour panel discussion. We had some insightful questions, hoping to make this a worthwhile presentation. And I think the hope was we wanted to gear this towards all members of the healthcare team. So it wasn't driven just towards physicians, residents, because patients would just relate one anecdote. This is not evidence-based medicine. This is not science that you hear in conferences, but they would just relate one anecdote. And they did specifically about one of our residents, Mike White, who's actually going to do surgical oncology. And they said, the lab people would come at 5 in the morning to poke us every morning to get their blood work. And, the residents also, as you know from a lot of our lives, they round at 5:30, 5:45, 6 in the morning. So they're really waking up these patients to round and see how they're doing. And Mike was just kind to them. He was just kind when he walked around and he spoke to them and he talked to them. And I think just relating experiences such as that, you don't need evidence-based medicine to be able to incorporate some of those factors of saying, well, maybe I shouldn't wake these folks up so early in the morning. Or maybe if I am waking them up, at least I'm kind. I'm not just ripping dressings off someone's abdomen. Because we do take dressings off the abdomen. Some of the works that we do are not particularly pleasant, but there are ways of doing it. And I think just being able to relate to that, I think was what we hope to achieve. We also realized that there is a price that physicians and healthcare teams will pay when they have to take care of patients. So the comment I told you first about my colleague who told me, or my patient who told me that I should have called him on time, it came at a personal price because I was spending all my time in the operating rooms. I was busy, I was working hard, and where was the time for me to call this person? So how do I take care of myself such that I'm able to provide for my patient, be empathetic towards them? And so Neda from the Center for Chronic Disease Research and Policy was kind enough to speak a little bit about what she thought were ways we could balance our lives such that we could be more empathetic towards our patients. And so the first, we actually recorded this whole thing, and for those of you that are interested, I'd be glad to kind of share the link with you. But the first person, and this is the gentleman who had the courage to tell me not just that I was late, but many other things which I'm embarrassed to share today. But he told me, and he's a pediatric surgeon. He's a pediatric surgeon, worked for many, many years, very well respected. His wife was, and they've given us the permission to share this. His wife is a respected judge in Illinois, worked even in the Supreme Court. So this is not an ordinary, vulnerable family. This is someone who is well versed with the healthcare system, and we've known each other for now almost 7 years. And he's the one I had related this to the board earlier. He told me that he was sitting in a waiting room once, and he heard a team of our residents and our nurses just kind of laughing. They were just having a good day. And we heard about wellness. We heard about these concepts earlier. And humor and sort of just that camaraderie is important for us for our wellness. But what he told me was that, I was just sitting in this room, nervous. I've been waiting for 3 months for my scan. And here I am just waiting for someone to come in and tell me that my cancer is back. And here I hear people laughing outside. It just made me feel very vulnerable. And I think that just one experience, just taught me it's not bad to have fun. It's not bad to eat your food during clinic or do all those things. But there's a space where we can do that. And we have to be really respectful for where our patients are. And I think that one comment really certainly changed my practice. And I think he brought that up in some way during this conference as well. But he said, I came to realize that no matter who you are, A patient is nervous, they're forgetful, they're confused, and they're scared. And this was echoed and resonated by all the patients there. And so I think one thing that I learned, and I hope all of you will sometime, is the fact that these folks are human beings, but they're also under incredible duress when they're sitting in front of you. And it's our job as healthcare providers to help them as they're going through this tough journey. I think this is the second thing that we learned. This is Donna Rosen. You can see when she was diagnosed with ovarian cancer, patient of Nita Lee. This is with her kids. You can see a beautiful family. She was proud to embrace her bald look. And then this is what she looked like. You can see on the other side, this is what she looked like when she came to our meeting. And really, she just came up with this one quote, which I think is very powerful. It's very simple, but very powerful, that every doctor has multiple patients, but every patient has only one doctor. And I think for us to just recognize that concept, I think is great. And I don't need any evidence-based papers to really show me that this is an important concept towards delivering healthcare. And so I thought this is just a great learning opportunity. And I think finally, this is one of my patients, and this was a caregiver, Becca Schanberg, who spoke to us. This is her with her husband, Jack, who's had an incredibly difficult course through his cancer care. And really, sometimes all a patient needs is someone to say, you know what, I'm here for you. I'll take you through this complex process that you have. They just need a quarterback. And I think just the concept of saying we care for you, regardless of how bad your cancer is or whether we can treat it or not, whether you need chemotherapy, whether you need palliative care, whatever it is, we're here to care for you, and we care for you as a human being, I think is really just the message that they wanted to convey for us. And I think they went through, just simple things like you're getting an IV blood draw, patient has a port, just to show the compassion to say, hey, I'm going to use your port because I think it'll hurt you less. Simple things, but things that we can all do and incorporate. But I think the bottom line, and it's impossible to summarize everything that they said well, but I think every interaction that we have with our patients is extremely impactful. Trust and transparency, I think, is the key that patients want from us. And I think most of you in the room know this, and that's why you're here. But I think certainly it's something that I enjoyed hearing, even though I've been in practice for so long. What I learned through this, though, and this is something that I had never heard of before, but Andres Valencia and Sue Murphy from our Patient Experience and Engagement program brought up this concept of wellness that occurs from being close to your patients. And this is something that I've certainly experienced at times. I generally have heard of things where you're taking care of too many patients. It's very burdensome. You're more tired. You're more burnt out. But I think someone else had also mentioned this earlier, that the joy of the actual patient-physician relationship or patient healthcare team relationship, I think, is unmeasurable. And I think clearly this is something that I have enjoyed in my practice, but there is an evolving body of science looking at this as well. So I think that's sort of a brief summary of the event that we had back in August. We're hoping to do this again in collaboration with the Bucksbaum Institute. I think this is a unique effort, and Kay, thank you for that little seed of idea that you had many years ago in setting this up, because I think this impacts several of us and several generations of us in an area that is perhaps poorly understood. It is our softer side. It is the humanities part of medicine, but it is what makes us doctors or healthcare teams. So thank you very much for doing what you did.
I found the meeting extraordinary. Patients' families.
I mean, I think that's just I think an amazing idea. I think just the concept of being able to know the people that you're going to be taking care of. I think there's a slight difference, I think, in my mind about an event like this versus like sort of still in the clinical setting, because I think in the clinical setting there's still this whole anticipation, the care plan, what's going to happen. So there is a focus, and yes, clearly it's important to know the person that you're going to take care of. So I think that's important, and I think that's absolutely necessary.
I think with regards to this event, the way I think of it is as patients being able to summarize, perhaps in a more neutral way, their experiences and providing us feedback in a non-judgmental but an honest way to say, you know what, you've screwed up, and it's okay. But we never hear that. When a patient is seeking care from me and from you or from all of us, it's incredibly difficult for them to say, doctor, you're not doing a good job. And I think, what they do, their way of probably solving that very often is to move to a different position. And we're left perplexed because you don't know why someone moved away or you blame different factors. But I thought this was sort of the bigger part of saying, hey, let's just get the feedback on what are things, that we could do better. But I think your point is absolutely spot on.
Thank you so much.